to learn about Colorado's state plan on brain injury. Um, so I'm Kelly Miller with MindSource. I'm a project manager, and MindSource is Colorado's lead state agency on brain injury. So we have a handful of different things that we do, one of which is overseeing an advisory council on brain injury and working with that council to create a state plan on brain injury. So the plan is like a framework, just sort of a document we use where we put goals and objectives and ideas on where we want to focus our time. It's a living document, so it can be added to along the way. So what we talk about today is what the advisory council has come up with so far as different areas to focus energy, but it's not like completely inclusive because we certainly can add things along the way. And I was thinking maybe we start with some introductions. If you're comfortable with like any of the reactions, raising hand, or even just if you're on screen, comfortable to raise your hand. Do we have people who are with us who have lived experience with brain injury? Any caregivers for those living with brain injury?
You mean have brain injuries, you mean?
Yes, have
Yes,
experienced a
I
brain
do.
injury, yes.
I do.
Um, and any providers like physicians, doctors, clinicians, therapists, OT, PT. It's a big category of anyone who might be someone who provides services to people with brain injury, or caregivers as well. And maybe do we have any community members who are just potentially interested in learning about the state plan on brain injury? We're definitely hoping to have wide participation, and we did a meeting in Pueblo earlier this week to share the same information, and we are doing a meeting on Monday in Jefferson County at the library. So if anyone knows someone who you think might be interested, there's still another option to come in person to hear more about this. Thank you for sharing who you are.
Can I ask you a quick question?
Absolutely.
I live in a rural area out, on the western slope, and we don't have all the facilities like Denver, Colorado Springs, or Pueblo, the main cities and everything else. Should I still be on this call? You guys can't provide me any kind of information or anything like that. I'm too far out.
No, I would really appreciate it if you would, if you're interested in staying on the call, because one of the things our council that we talk a lot about is, yeah, how do we make sure people across the state have access to what they need in rural and urban areas? And so I would, we definitely want to hear your thoughts and your perspective, and that's a really common topic of conversation for us. And we
Well,
realize,
I
yeah.
don't want to interrupt your, what's going on right now. We've done this before, that the state's going to help this and that. We hear all this all the time, but nothing gets done. So that's just my thought.
Yeah, I understand that can feel discouraging for sure. Um, well, we have some ideas, and how it all comes together sort of remains to be seen, but having your voice here to just really, elevate the voice for people in rural areas is important. So despite feeling frustrated and maybe not having great experiences, I do really appreciate that you decided to jump into this with us this morning.
Well, that's the problem. People say all these words and frustration. I'm not frustrated.
Oh, okay.
Putting words in my mouth. I'm just giving my opinion. People say we're gonna do this, do that. It's like a pony show. And everything else, but nothing gets done. That's all I just said. I'm not upset. I'm not mad or anything. That's how people get a little upset when people use words that it's not what they said.
Right. And so I apologize. I certainly didn't mean to put words in your mouth. I
Well, I
understand
think at this
the
time
opinion you're
I'll
sharing.
pass. Yeah, I mean, you have a good day.
Okay, okay. All right, so I'll jump back into what our goal for the agenda today is to share information about brain injury. I think there are a lot of people who are here this morning who have experience with brain injury, so you maybe have some foundational information, but we want to just provide, context and information for people who might be joining us who are maybe new to learning about the community. And I'll share information about the state plan on brain injury, the goals and objectives of the plan, and then I've carved out time to ask for everybody's feedback and thoughts. And then at the end, I'll share a little bit about some resource information. So Colorado's definition of brain injury was changed in 2019 to become a little more inclusive. Originally, Colorado's definition focused only on traumatic brain injury. Now, our definition of brain injury is acquired brain injury. So injuries that happen as a result of a traumatic event, being hit in the head, like a car accident or maybe assault, and then also injuries such as stroke or lack of oxygen to the brain, maybe because of strangulation or electrocution. So we're proud that our state has a definition that's a little more far-reaching than other states, because we certainly want to be helping as many people as we can. So just a word about, acquired brain injury. So there's a lot of causes of brain injury, not just a blow to the head or being hurt physically in an accident, or things like pressure from a tumor can cause a brain injury, electrocution. Unfortunately, seeing a lot of opioid overdose and that leading to brain injury for people. So there's a variety of ways that people can experience a brain injury. The scope of brain injury is pretty staggering when you think about it. Over 500,000 people in Colorado have experienced a brain injury, and we think that number is actually a bit low. Colorado ranks 9th in the nation of fatalities and 13th in the nation of hospitalizations due to traumatic brain injury. So that doesn't even include all the other causes of brain injury. Over 23,500 emergency visits each year due to a traumatic brain injury across the country. And each year, a lot of people continue to live with a disability or the impacts of their brain injury. So a lot of brain injuries are mild concussions and they resolve on their own after a couple of weeks, but that's certainly not the case for everyone. So let's talk a little bit about the Advisory Council that I mentioned. The Advisory Council is a group of around 20 people. The makeup includes at least half of people who have experienced a brain injury. And the council's main task is to sort of identify gaps in services and figure out ways to address those. So ways to create services to help people or maybe elevate the things that we do have going on. And that is a council that is managed by us, by MindSource. But we have co-chairs that lead the group, and at least one of our co-chairs has to be a person with lived experience. So we have a lot of great voices on that group and people from across the state, metro area and rural areas across the state as well. These are some of the agreements that group has. And I want to share because this is sort of the lens through which the state plan came together. So the group feels like together, unique perspectives, creativity, and commitment to advocacy for people across the state is really important. The group feels like everyone on that group, individual, personal, and professional experience is valued. So no one person's opinion is more important than the other. And that group invites everyone to participate. And that group feels like they're stronger together because they have different lived experiences. I'm sure everyone who is living with a brain injury knows that no two brain injuries are the same. So that's something that we really, we share with people when we do trainings is if you've seen one brain injury, you've seen one brain injury. And these are just some of the guiding values for that group too. So being a champion for accessible, equitable, and inclusive supports and services, really looking at way to support people across the lifespan, not just immediately after an injury, but across the lifespan, and focusing on person and family-centered care and needs, and celebrating all brain injury journeys, because again, each person has a unique experience. So far, what have we done with this state plan I keep talking about? Well, the group kind of identified their values. We developed some big goal areas. We created subcommittees, and those people met, came up with objectives and goals, presented back to the larger council, got feedback, they voted on it. And so now we're at the point of doing meetings with people in the community and our partners. So what I'm sharing with you today started in January as just a meeting of what's our first step. So there's been a lot of process that's happened since the beginning of the year until now. And this is just sort of a timeline. So we're here in the fall doing some community meetings. In November, we hope to kind of have a draft of the plan and like a nice one-page summary that will be sort of concise and a nice one-page overview. In December, we'll hopefully distribute it, get approval from the leadership within Colorado Department of Human Services, where our program is. And then in January, we'll start implementing the things that we've identified. And everything that we do, I just want to say, we also evaluate. So we have an independent evaluator who works with us to kind of track and monitor our work. And then we report back to the advisory council. When I say we, I mean MindSource and the advisory council, but just so everyone understands, we have some accountability for what we do, and we take that seriously. Look at this mega slide with highlighting and a lot of words. So these are all the people we've identified as agencies or entities who we know will partner with in the next few years when we implement all these goals. And everyone in yellow, every agency in yellow has a representative on our advisory council. So we have people from different entities across the state: Centers for Independent Living, Craig Hospital, the Department of Education, the Department of Labor and Employment, Division of Vocational Rehabilitation, healthcare policy and financing. So, and a lot of people from these agencies also are folks who have experienced a brain injury. So we think we've got some really good, partnerships built into the membership in our advisory council. So goal area 1, we have 3 goal areas. So the first one is about designing a system of supports for early identification and effective referrals for individuals and families impacted by brain injury. So that's very similar to a goal we had in our previous plan, and the group decided to stick with that. And I'll share with you the strategies that we've come up with to try and do this, to try and really strengthen early identification and effective referrals. So strategy 1 is conducting an environmental scan to determine where screening is happening. So what that means is we would look at, places in Colorado that are screening for brain injury. Are there doctor's offices? Are there behavioral health settings where someone comes in to receive some mental health or behavioral health support that they get screened for brain injury? Are probation offices doing it? We know that some are. So we would really try and look at take a wide lens across the state and see who is screening for brain injury, and then see if we can determine maybe where the gaps are, where we could try and implement some screening. We think that screening is obviously a really good goal to have in terms of early identification and then effective referrals. So trying to just strengthen that screening across the state. And then, strengthening partners who are screening, providing support to them, and then developing or adopting and implement an approach for incorporating brain injury screening into routine wellness exams. I think that routine well, we've seen routine wellness exams have started to include things like depression and anxiety screenings. And so we had the idea of, could they also include a brain injury screening? Second strategy under this to try and strengthen early identification and effective referrals would be to look at the Brain Injury Alliance of Colorado's resource hub. So they have a page on their website that has a bunch of resources listed. And we had the idea of looking at that and expanding it, making sure that it's brain injury friendly for people who want to access it. And then connecting that hub with statewide resources and providers. So like sharing it, making sure everyone knows about it, and that we could house it on a MindSource resource
That
page.
was the
So it might move,
Scrum.
or it could be the same
20,000
directory in both
that's
places.
the
But thinking that expanding a resource directory could be
Yeah.
helpful in terms of effective
that's the liquor,
referrals.
the company that does the liquor or the bar for True Grit.
I'm sorry, we're hearing someone's conversation. I just want to say you might want to check yourself to see if you want to be on mute. Just, it happens.
Oh, good heavens, no.
Oh, let me see. Okay.
Right. Yeah. So I don't know what you're looking at, but that was that contract that you and I
Let me
talked
see
about,
if I
and you
can
signed, or the
mute,
agreement you signed that
participant.
said, we upgraded and all that. So
let's see if that helped. Okay, next strategy. So to look at the hospital to community transition,
I did.
and figuring out how to
I let Jim know.
just make that. I'm sorry, there's a participant who's speaking who isn't muted, and we can hear you. If you can please mute yourself. Thank you.
Okay.
I'm still not hearing me.
Oh, I understand. Sure.
Kelly, I think if you
Right.
right-click
Okay.
on that
Well, I'm
person,
sorry. Yeah, I
you
thought-
can mute them. I'm not positive.
Yeah, I may have to just stop sharing my screen for a moment.
Okay. Yeah, and I don't
Um,
like doing those type of things on credit cards, and I always ask.
I think I've gotten the correct click. Thank you, everyone. Apologies. So next strategy is looking at how to create hospital to community transition planning. Looking at what does exist and what is the need. When we shared this goal with a group of folks in Pueblo, we discovered it seems like maybe things are just different for everyone when they leave the hospital. And so looking at what's a consistent way to ensure that when people leave the hospital, they have some resources, they know what the next step could be, and they feel supported, and they get some follow-up from someone. Hey, you just left the hospital a few days ago. Are you settling in? What do you need? How do we support you once you've left the hospital, and getting connected to what you need for the individual with the brain injury and for their family or caregiver. And then we in March did a campaign, an awareness campaign called Mind Your Brain was sort of our hashtag that went along with that. And so we have the idea, the council has the idea of trying to, expand that and keep it going. And possibly partnering with a vision and outreach committee we have that exists under another board to look at some funding opportunities to keep it going, to create some new content, and then just exploring opportunities to promote brain injury awareness year round. We did a big focus in March in Brain Injury Awareness Month, but what could we be doing, every month of the year to keep some awareness going in the communities? So that was a lot of information about goal 1. It's a big goal. A quick recap of it is to expand screening, expand a resource hub, focus on the hospital to community transition, and then really build upon our Mind Your Brain campaign for awareness. So, hearing all of that verbiage from me, does anyone have questions? Or feel free to jump in with just anything you'd like to share that struck you. Or if we have like 3 sort of conversation questions. Yeah, Jules, go ahead.
I just know from my experience, I was seeing after my brain injury, neuropsych, neurologist, OT, PT, cognitive therapist. My doctor, not one of them mentioned BIAC or gave me any information for any brain injury groups. I know my sister works at Children's inpatient neuro, and they do give out information to their patients. But I had no offer, I found BIAC on my own.
Thank you for sharing that. And we've heard that from other people as well, that they found BIAC on their own, and it took time to find them. So that is really interesting that you share about Children's Hospital. Maybe, that's a strategy we could use, is contacting them and seeing what's their protocol for when people are released. What do they provide? And maybe adapting it for adults is, thank you for sharing both those pieces.
And something else I found interesting. Oh, and I'll also include my mental health therapist in that list of doctors. They all know what BIAC is. When I tell them how involved I am, they all know about it. So I'm just not sure why they're not referring people to it while they know it exists.
Yeah. Anyone else thoughts about, I think we have people here from different, who work in the helping profession, just in different places. Any thoughts on opportunities to move these strategies forward? Like, do you know of anyone maybe to partner with around brain injury awareness, or is anything that sounds like it might be a fit with current things you have going on, current initiatives in other worlds? And certainly anyone can always reach out to me after this with thoughts. I'd love to get, continued feedback and just be on your radar in terms of when something brain injury related comes up for ideas. All right, well, I'll jump into goal 2, if that sounds all right. Goal 2. The focus of goal 2 is to build a sustainable or long-lasting, straightforward, so just very clear, efficient system of ongoing supports for people with brain injuries across the lifespan. So that again is like a really broad goal, right? That could include a ton of different things. But our council narrowed it down to a handful of different strategies to try and accomplish this. So one idea that we have is really to focus on increasing brain injury informed behavioral health services and supports. So providing training to behavioral health providers, therapists, and counselors, and expanding screening in behavioral health settings. And then looking at tracking outcomes for people who received brain injury informed care, maybe checking in with therapists after the fact of, hey, you had this brain injury training and you did some screening and you knew that 5 people you worked with had experienced a brain injury. How do you think that impacted your treatment? And then talking with individuals too. Did you feel like the treatment you got or the support you got was brain injury informed? We're just curious of like the benefits that people could see from having a brain injury screen and providing brain injury informed services. And we do have some wheels in motion as far as the training piece goes. I will just say MindSource is creating training content for the Behavioral Health Administration. So we have some seeds planted with this. Second strategy would be to advance the use of the Colorado Symptom Questionnaire. So Colorado has this really cool tool that was developed through DU, some students, and Dr. Kim Gorgans at DU. And it's a questionnaire for people who have experienced a brain injury, and there's some different life domains. And like maybe one is sleep disturbances. And then there's some sleep symptoms, like do you have trouble falling asleep? Do you have difficulty staying asleep? Talking about fatigue that you experience. Every symptom, you check a box. And so once you complete this questionnaire, then you can get tip sheets that say, it sounds like based on the questionnaire, you could use some help with organizing your thoughts and managing your schedule and improving your sleep. So then you would get a tip sheet with information that would line up with all the symptoms that the person endorsed. So the idea of updating those tip sheets to include resources instead of just, hey, here's some suggestions, but maybe also include links to different resources. Maybe doing some research on that symptoms questionnaire to make sure it's a validated tool. Improving the visibility of it on our website. It's kind of buried in our website. And then embedding it just into trainings that we do so that we really are making people aware of this tool that we have, because we think it has some good, could be very useful for folks. Another strategy under this goal is to increase education and accountability to address gaps in professional support for people with a BI waiver. So what does that mean? We had some conversation amongst our council of people maybe not knowing as an individual about the brain injury waiver, what is covered under the brain injury waiver, and then professionals who are working with people who have a brain injury, same thing, just not really having awareness of the waiver, what might be covered under the waiver. And so the idea of training case managers, and that can be case managers in a variety of different agencies, single entry points, community center boards, Department of Human Services agencies, but really just trying to get people some brain injury informed training, and increasing awareness for members and caregivers on the brain injury waiver of what the array of services are and what are their rights and what questions maybe they can ask to advocate for themselves. Another strategy was to develop like a resource options booklet that would guide people through the steps for identifying and accessing services and supports. So kind of like what was mentioned earlier, maybe, post-injury, people might get connected with OT, PT, neurosurgeon, but a couple of things get left out, like maybe the Brain Injury Alliance of Colorado, or so just creating like a booklet that might list those array of different options and services that people could be aware of. And this piece about determine if the MindSource client services logic model is a good starting point. That's like an internal task for MindSource that we would do. But this could connect with the idea of creating like a brain injury passport that someone would have to help track appointments and, providers, phone numbers, next appointment, just knowing, maybe something paper, knowing that for some people doing that on a phone or in the computer with technology can be challenging. So it might not be a resource that everyone would use, but it would be a resource that everyone could use. So again, I just shared a lot of information. A quick recap about this goal. The ideas that the council had is to increase behavioral health services and supports that are brain injury informed, advancing that Colorado symptom questionnaire, looking at gaps, address gaps to support people accessing the brain injury waiver, and then exploring creating like a resource options booklet or like a appointment passport type of a book that people can use to track things. Any thoughts or any questions about all of that? Again, this is another big goal area, so we could probably have 100 goals under this topic. Or any thoughts about what you think sounds like the best idea out of all of these, like maybe what to prioritize, or again, any opportunities that you think we could take advantage of to move these forward. And I apologize because I can't see I can't see like if someone necessarily raises their hand because I am in sharing screen mode. So if anyone wants to just shout something out, feel free. And I know this is a lot of information to like digest right now. So like I said before, certainly would love to hear from people down the road about thoughts you might have. And the document, the state plan is on our website in document form. So you can absolutely look at it afterwards if you're interested, or you think, wait a second, what was that she said? I want to understand that a little better, or you get curious about something at some point in time, it'll be on our website. Well, I'll move into talking about goal area 3, which is the shortest. So you won't have to hear me talk a whole lot longer. Goal area 3 is around promoting inclusive communities and systems while also supporting people with brain injury so that they can engage at home, work, and school and the community in the ways that are meaningful to them. So again, a big goal, but there are a lot of things I think around goal 1 and 2 that kind of intertwine with this. That if we accomplish things in goal 1 and 2, they'll lead to this as an outcome also. But we did identify a few specific strategies just underneath this big umbrella of a goal. So one of our strategies is to look at training for navigators and peer supports and professionals on how to support meaningful engagement in the community, school, work, and home for people. So, you know, we know there are a lot of wonderful peer supports and peer mentors through programs, and they do receive training. And we thought, well, is there additional training that could be provided around really supporting person-centered, meaningful engagement in all areas of life? So thinking about that, peer supports are probably the people who are the best at doing this. So maybe even just modifying the training that they receive to share it with like navigators. You know, a lot of agencies have case managers. Resource navigator is a big, I think a kind of a buzz title in the last few years. So just trying to identify people in helping professions who, if they had some brain injury informed training, they might be better able to support brain injury people in meaningful engagement in different areas of their life. And we talked too about the importance of maybe doing this with employers and educators as well. And then sharing this as well with family and community members too, even just, in terms of awareness. Ta-da, feedback already. So that was, like I said, sort of the shortest one. So just the recap again is kind of focusing on training for navigators, peer supports, and professionals on how to support people. And I think what would go along with that, but we don't necessarily have it articulated here, is follow up after the training afterwards too, circling back to people to say, You know, what have you changed since the training? What have you wanted to change, but you haven't been able to? How can we help you take some steps forward? So not just like, here's some information, best of luck, please do your best. But, you know, circling back to provide some supports and some check-ins to try and lead to something successful happening. So any questions about that piece? Yeah, Jules, I see you.
Green the cooler.
Oh, I think you're muted, Jules.
Take it back. God damn it.
So I'm a mentor and I volunteer,
I
but if you
bought
had
one.
professionals doing it,
I was so
Would you
focused
be
on the
paying
donations
them,
that I didn't even know there was
or-
a side.
Oh, I'm
So
sorry.
yeah.
Let me
Draft.
I hear
It's
some
like, draft.
hearing some talking.
Take that.
Sorry, can you
I
oh
don't
wait,
have to cover it specifically tonight.
let's see.
Just needed to drink. Um,
Okay, sorry. Go ahead. Go ahead, Jules.
okay, so I'm a mentor and I volunteer, but if you had professionals as mentors as well, would they be volunteering? Would they be paid by insurance? Would you be paying them?
Well, that's a good question. I think it would be more of you know, if they wanted to volunteer, then I think that would strictly be volunteers, maybe through BIAC or through their own agency. But what we would want to see is that they're integrating these pieces into their professional role as well, so that it becomes part of just what they do, and how they support people who are living with a brain injury. So I think that's something I had not thought about. So that's a good question. Does anyone have thoughts on things that you'd like to see us include? Like I said, this is you know, it's a plan that is just sort of a blueprint for the next 3 years, and I can foresee adding to it because things come up all the time that we want to focus on. And this also doesn't mean that this is all we're doing. We have a lot of work that goes on outside of what we do here too. But any thoughts on like, oh, I really think you missed a piece or something? Lori.
I had a little bit of trouble following because of my injury. But I do want to reiterate what Jules was stating, that it was very difficult in the beginning to find BIAC and support on my own. Neurologists are not recommending anything outside of them to get help, and you have to be your own advocate to get any kind of support to get better. And if you're not in the mental state to get any kind of productive help, then you're not going to get better. And if no one's there for you, or that what you're doing here is wonderful, and there needs to be more advocacy, and I really hoped that it would be easier. I'm at a loss now because my neurologist just quit on me. So I need to find a new one, and I'm going to be turning to BIAC for a referral. And I'm so thankful for all the work that I've gotten from everyone and these groups and everything that's going on here. I can't imagine if I weren't in a better state of mind trying to do this. So I'm trying to follow along on everything, but my head isn't clear with these white screens and hearing you at the same time. Doing multitasking is it's a little difficult, but what you're doing is amazing. Thank you.
Yes, thank you. And I will say, I know it's a lot of information to digest, and I agree, we should change the background to these slides so they're not white. I don't like that either. Thank you. Yeah, I think I hope things go well for you in navigating what finding a new provider, and thank you for sharing that. Vicky.
Hi, good morning.
Hi.
I think my name is Vicky Ortega. I'm a survivor, and I'm also on the MindSource board, and I'm really excited to see the plan and hear this presentation. My question, I think, is maybe the goal before, or is the goal that talked about inclusive, an inclusive approach or inclusive, and I don't have the language in front of me. But I was hoping to hear a little bit more about what went into the thoughts to be inclusive on that goal. And maybe if you have a little bit of information about how that would be implemented, did that mean geographic inclusivity, provider inclusivity? Did that mean anything more?
Yeah, good question. I think the intent behind that was pretty broad. Looking at, I think, like I mentioned before, one of the big topics we talk about is rural versus urban. So a lot of the inclusivity conversations we have in the council really focus around just equitable access to services across the state, no matter where you are. And then also looking at historically marginalized communities, because we know research tells us that there are populations who don't fare as well in there's definite health disparities and health inequities based on social determinants of health. People of color have less access. That I just recently came across a study that said that when it comes to discharge from the hospital, people of color are less likely to be referred to rehabilitation services. They're just more likely to be just discharged, which is really sad. So there's definite inequities there. So that inclusive is really a broad reach of trying to look at marginalized populations and then also rural, urban, frontier communities across Colorado as well. And so I think, there's how that will play out in the details of what exactly we do and how exactly these goals come to life, could look, could happen in a variety of ways. We're not quite there to operationalizing everything yet. But the council will be tasked in part with MindSource in determining how this all comes together. And we did do a needs assessment in the last year where our focus was on rural and frontier communities, the Latinx community, and LGBTQ plus communities across Colorado. And it really sort of confirmed what we already know, is just there are a lot of health disparities for people in those groups. And one thing that was helpful that came out of that needs assessment is we did a lot of outreach to agencies we hadn't done outreach to before. So I think that improved the awareness of MindSource as like, hey, did you know in the Colorado Department of Human Services, there's a brain injury program. So I think we landed on some people's radars and hopefully we can build from there. I hope that helps. It's not exactly a super clear-cut answer.
Well, I think it was helpful. Thank you so much. I'm glad to hear that there'll be some more dialogue on seeing what that would look like down the road for implementation.
Yeah, I mean, we have, I think internally with MindSource, we have a lot of ideas and we would like to at some point focus on Indigenous people and we're connected with some other states who have done some work in that with tribes in their states. And so we've kind of started a bit of like learning about who could support us in that work and what's the best way to start engaging with Indigenous people and with tribes. And so we want to be really intentional and thoughtful about what we do so we do it right and don't, continue to do something inadvertently that marginalizes people further. So Jules, did you have your hand up there for a sec?
Yes, I think one piece that's missing is the social media component. I think a lot of people with brain injuries get on social media, and I just don't really see anything much,
That's a good point. Yes. Because I think in March we did some social media for Brain Injury Awareness Month, but what about the other 11 months of the year? What could we be doing? Yeah. And not just us, but other brain injury supports across Colorado. One thing we did last year that I'll just say that was the first time we had done was for Brain Injury Awareness Month, we created a digital toolkit that others could use. So anyone could come on and download posts for Twitter and Facebook and all those social media things. So I think that's something we could grow on and expand. And a cool piece of that was we partnered with the Colorado Department of Transportation, and they created some really cool media stuff that they put on their social media. So I think we have some seeds planted, but you're absolutely right. That's an area where we could do some growth for sure. Well, I'll share. I mean, I think a lot of people know about these resources, but here's just a handful of resources. The Colorado Department of Education has concussion teams, and we've got a couple of people who specialize in concussion management and supporting schools. So we've got an education link. There's a handful of things here. And if anyone who's here today has questions about resources, please just go ahead and email me or reach out to us through the MindSource website. Be happy to help you. In conclusion, the final plan will be on the MindSource website. And if you are ever interested in joining one of the advisory council meetings, they're open to the public. They're always on the third Thursday of the month. And right now they're monthly. Well, we're doing this state plan, but then they'll shift to quarterly at the beginning of the year, most likely. So if you're ever interested in any public meeting that the Colorado Department of Human Services has, you can find their calendar on the CDHS website. So public is always welcome to attend those meetings, and we always reserve time at the end for public feedback. And honestly, we'd love to have people join us. So yeah, and here's me and my contact information. So thank you so much, because I know I shared a whole lot of information in a pretty short amount of time. And then I asked you for a bunch of questions on a Friday morning. But I really appreciate it. I'll put my email in the chat also. Oh yeah, Jules, go ahead.
I wanted to say something. which is that I feel so blessed to live in Colorado because I have friends all across the country, especially learning or getting to know them through Love Your Brain, and they do not have any of these opportunities. And they are so, so jealous. And I have a friend in Wisconsin who's now working with the state to try. And she said if they could be, if Wisconsin could have 1/8 of what Colorado has, she would be thrilled. And I have friends that have moved out of state and they do not have these opportunities. So I just feel like insanely blessed that we have all that we have here.
Thank you for saying so.
And I mean, I'm sorry. I'll just say that this has really been a lifesaver for me. It truly improved the quality of my life tenfold. So very grateful.
Well, that is wonderful to hear. Very good. I do think Colorado is kind of seen as a leader in the brain injury community, but we also know that there's just always a lot of work to do. And we do partner with a lot of states. We get some federal funding, and part of receiving that funding is that we partner with other states to support each other, and a rising tide lifts all boats. So we're in this with about 30 other states that we meet with in different work groups and we connect with, and we send emails. Does anyone have ideas about Concussion Awareness Day? And people respond. And so there's a really nice network between other states. So hopefully we can get Wisconsin to up their game for your friend, and Colorado continues to up our game, because we're doing some good things, but there's always room for more, for sure. Yeah. All right. Well, I just, again, thank you so much for for sticking with me and listening to me, just share a ton of information. I really appreciate your time, and you've got my contact information. So anything that comes up, please feel free to reach out, even if it's a random question or you hear about an event somewhere. We're happy to put things in our newsletter that goes out. So we'll love to partner with people on things like that. All right. Well, everybody enjoy your weekend, and we're done early. So now you can, you have an extra hour to your day. Thank you so much.